I've got a fantastic new surgeon that I brought on board, Spex Hair, Dr. K in Athens, Greece. And I'm really privileged to have his time today to go through a number of questions so that listeners can get a little bit more insight into him and what he performs at his clinic. So, Doc, thank you so much for your time today, and really interested to get into various bits and conversation about hair restoration and for patients to get to know you a bit more. So thanks for coming on board.
Thank you. It's a real pleasure to be here with you. And honestly, I really appreciate what you do for the field, for the patients, and how you help honest and skillful doctors to communicate with patients more, I wouldn't say directly, but without all this clutter and all this noise that advertising is causing, and it confuses patients.
Yeah, no, indeed. I mean, as a patient advocate, there are a number of really honorable patient advocates in this space. I've been in this space for over 20 years. Leads me on to my first question, I suppose, in terms of patient advocacy and transparency. It's like independent patient advocacy has become really important in hair restoration. And so I suppose from your perspective, just to reiterate as a surgeon, where do you feel that patient advocacy helps your patients in terms of like kind of, i.e. education, accountability, setting expectations? We like to be able to put patients in touch with honest, ethical surgeons such as yourself. But from your side, how does that help you in your practice?
Well, to answer the first part of your questions, in this era of social media and of so fast access to information, there is a war for attention. And usually the loudest and the most animated voice gets most of the attention. This is why in many fields, and also in this field, people will hire, so clinics in this case will hire some celebrities to advertise that they did surgery in their clinic, and this will get a lot of attention. What's funny is that nobody has the time, and very few people have the maturity to wait to see the result on this celebrity's head.
No,
So
they
they
don't.
see, get the attention and they get the awareness about that clinic from this celebrity having surgery, but they never care about what happens next. And during this time that maybe that you need at least a year to see the result, which might be a complete failure, a lot, hundreds or maybe thousands of patients have trusted that clinic who advertised through a loud celebrity. This is where people like you come in, and that you have the experience, you have the honesty, and you have the maturity to say, whoa, guys, wait, I will test these things for you. I will having know-how on seeing what really matters and what doesn't matter. So what is a real skill and what is a real advantage of a patient or of a surgeon or a clinic, and what is just noise. And I will present it to you in a short, understandable, and easy to digest way so that you can make an informed decision, to make it as a better decision as possible. Because from what I have understood, what is probably the most important feeling that a patient or someone who is interested in any kind of surgery, selective surgery like hair restoration, wants to, or at least should want to feel, is to feel safety, to feel certain that he will have the result that he's expecting. The point is that this patient can be tricked into believing that he feels safe because someone is pressing some buttons on his in his brain,
Indeed.
while you come and say, no, forget about this. This is the way to be safe, not to feel safe, to be safe. So this is why I believe that what you're doing is extremely important for patient safety and for helping to clear the field.
It kind of dumbs down the noise, definitely. You make a really valid point there. Like, I don't think I've ever witnessed a celebrity, if I have, there's a few of them that go out all singing and dancing, claiming they've had a hair transplant. The reason they do that is to more intents and purposes, get a free hair transplant. I don't think I've ever seen one with a really, really good positive result. And that speaks volumes, really.
Yeah.
Yeah, patients do need to be aware that just because a celebrity has said he's been somewhere, in actual fact, that should be a red flag to avoid that particular clinic, because celebrities that, I've dealt with countless celebrities over the years that no one would know they've had a hair transplant, and they don't go singing and dancing about it in, the Sun or the Daily Mail. They tend to, have done their research, go about their business, and get a fantastic undetectable result. What you tend to find is with these patients or these celebrity patients that go and have a hair transplant and sing and dance about it, often end up then in the media a year later getting another hair transplant with a different clinic. And so the cycle
You know
goes
what?
on.
So I'm 51. So what you and me, and you're probably around 40. So
I'm 50. I'm 50.
okay,
Yeah.
that's great.
Take out 41 though.
Okay, so listen, people our age, the celebrity that we have in mind is something like Michael Jackson.
Mhm.
He was the archetype celebrity, or someone like the Pope, or someone who is a real celebrity in films, music, or sports. However, in today's time, a celebrity is someone who has like a couple of million followers. Imagine someone, or even less, like 200,000 followers. If 1% of these 2 million followers, which is nothing compared to what a real worldwide celebrity is influenced by these pseudo celebrities or TikTok or YouTube or Instagram celebrities influenced to say, so this guy went there. Okay, I will also go there. It's still something like 20,000 patients. So it's amazing. So the celebrities that you're talking about are like mega celebrities. I'm talking about even local celebrities, or these so-called influencers. And another thing that I want to say, which is an example that I often give to patients, a really inherent a logical fault that a lot of patients do is that they see a clinic or a surgeon like myself that I have a high fee, and they see another clinic in another country who has a very low fee, and they compare it with air travel. So they see that, okay, Dr. Anastasakis, Dr. K is like flying first class with Emirates, and that other guy in Turkey is like flying with Ryanair. This is totally wrong. Why? Because aviation is extremely regulated. Everything is regulated. And the safety you have with Emirates First Class and Ryanair is actually the same.
Mhm.
I may tell you that even with Ryanair, it might be even a little bit higher. However, in the hair restoration field, nothing is regulated. It's so unregulated that it's not illegal. It's not illegal, it's gray. Non-doctors performing the surgery in practically every country in the world. So it is so unregulated that it goes over the head of all of most patients. And they make this mistake to say, no, it's just a service and the name. No, it's 100% about safety. If you go to a respectable surgeon like the ones that you have in your society, the plane will land. In most other cases, the plane will crash.
Well, that's a great analogy, Doc, and one I've never heard of, but it's one that hopefully patients will realize that this is not a cookie cutter type of procedure. It is. There are so many nuances to it that for the average patient that's just finding out about hair restoration and they're desperate because they want to get their hair back as quick as they possibly can. They're not prepared to do the research onto it, and they think that anybody can perform this procedure for the most part the same. Expectations aren't necessarily in line with where they need to be and around the reality of hair restoration. And what they do is they're governed by price, sadly, and they essentially have to end up learning the hard way. And this is where my role has come in, has been so important to help these patients dumb down the noise that exists now as a result of social media. And like you've just mentioned, anybody can claim to be the best in the world and set up an Instagram channel and throw thousands and thousands of pounds at the marketing campaign, and people will believe it. But as I often say, as my analogy is if I was going to go and have a heart transplant, I would do more than an hour's research on Instagram and TikTok, and I just wouldn't go with the cheapest surgeon that was saying that he could do it and he can get me in tomorrow, and because there's been a cancellation. But sadly, hair restoration or hair loss, because of the desperation and the vulnerability that still resides there. And I've been out here trying to break down this social stigma and trying to make people aware that they can talk about it and it's okay to talk about it, because through that dialogue, they gain information and they get informed and they realize that there are surgeons that perform this surgery day in, day out. This is the only surgery that they perform. And hence they're going to end up with a far more significant, better mid end result, because hair restoration is a long-term investment, as you know.
It's a lifelong investment.
Sadly, this is why conversations like we're having now are vitally important, because if just one patient sees this interview and it makes them press pause and do a little bit more research and have consultations with doctors like yourself or other surgeons that I'm associated with, or they find the 8 Gentlemen's Best Hair Transplant Surgeons in the World article, and it makes them stop and get educated and scratch the surface. Because, like I say, everybody's just ready to, they want it now. We're living in an Amazon Prime kind of society where everybody wants to click the button. They want it doing straight away. They want it to be delivered straight away. And sadly, after having 13 hair transplants myself and being one of the, a veteran in the field, I see this day in, day out. Despite the fact I'm repeating myself a lot with all these interviews, it's important because the message is really important that patients get educated. And it's fantastic that surgeons like yourself are willing to promote that fact and willing to promote patient advocates like myself, that patients can get protected.
Let me make 2 comments about this. I like the analogy with the heart surgery. And let me add something on this. Heart surgery is regulated because in order to have heart surgery, someone has to be a thoracic surgeon. Then, so he gets a degree on that by a residency. Then he has exams. And then in order to do heart surgery, he has extra specialty for another 3 years, which again, he has exams. And all this time, he's surrounded by seniors who educate him and teach him things. And then he will perform this heart surgery inside an institute, inside a hospital. And if he's not good, and if he's causing a lot of side effects, if he's causing a lot of complications, sooner or later, somebody is going to call the authorities on him. And so the people who are out still doing heart surgery are actually the best. In hair restoration surgery, everything happens behind closed doors in private practices, and it's extremely interesting. And I'll tell you something that you might have noticed also. In the last 12, 13 years, I have examined more than probably 2,000 repair cases. So people that I need that have done a previous surgery, and they come to me in order to correct it, to repair it, or whatever. Not a single one, seriously, from 2,000, more than 2,000, 0% of these patients have left a negative Google review on their surgeon who botched them up. 0%. I ask everybody. I ask him, did you do anything? I'm not expecting anybody to go to the police or the authorities or do any kind of legal action. No, just a simple Google review. This guy, I'm not satisfied. This is the picture of my result. Beware. 0%. Can you believe that? Nobody. So everybody is really trigger happy to give a negative Google review because he went to this fancy restaurant and they didn't treat him like a king. But when somebody destroys their life and their appearance with a terrible surgery, they do nothing. I don't know if it is a Greek thing, but so people must be really, really careful because lack of negative Google reviews means nothing. Seriously. So
Indeed.
What I suggest to people in order to help them shorten their research process, I tell them, check for 2 things, or maybe let's say 3. He or she has to be a doctor. Do not go to anybody that you're not sure that he or she is a doctor. Number 2, check the Google reviews. If the Google reviews are honest reviews with photos, people who are satisfied with the result will promote their doctor, will show, listen, this is me before, this is me after in their Google reviews. I have hundreds of these. And the most important, check for videos of results, not photos, not promises, videos. Videos with close-up, videos with the hair being combed, with the hair being getting wet, real life conditions with good light, so that you can see what was the situation before on a video. It's extremely hard to fake a video, especially if it's just a simple video that you shoot with a phone. Photos can be so easily manipulated that I wouldn't trust anything.
No, indeed. That's a really, really important point you make. And I know on your website, which we'll refer to on this interview, you house countless videos,
Hundreds, 700 at the moment.
yeah, very impressive directory of evidence. And that is essentially the key ingredient to look for when researching a hair restoration surgeon. Now, Doctor, I've been familiar with your work for a while, and it was a result of speaking with a number of patients that had just that great experiences with you. And as a result of it, I felt it really important to give other patients, especially over in Greece, where there aren't that many very good surgeons, in fact, that you were given the exposure that you deserve. And I felt it important to incorporate you not only in Spex Hair, which is obviously my own platform where I house a number of surgeons, an educational platform, but also incorporated you in this year's 8 Gentlemen's Best Hair Transplant Surgeons in the World article. Now, the article resides there to create awareness to patients because of the millions of views that the article receives. And it's to give exposure to good surgeons. But more importantly, would you not agree? It's there, if you read the article, it's there to educate and to empower patients so that they have options available to them, so that they are in a safe environment to get informed opinions from a variety of surgeons. The list of surgeons is not exhaustive. I can't incorporate every single surgeon in the world there that is brilliant. You know, there just isn't enough room. Relatively speaking, there are only a handful of surgeons given the number of them that are out there performing surgery. But I just wanted to address the fact that, you know, and make patients aware that you have been incorporated in this very well-known article and that you are a big advocate of the message that resides within it, and understand that it isn't about being on a list of surgeons. It's more about making sure that patients get accurate, honest information and in turn are put in touch with surgeons that will guide them ethically and honestly. And a number of patients that have found that article have actually informed me and have publicly gone on record with shows like The Bold Truth and said that it saved their lives. But
I'm 100% agreeing with you. So independent evaluation like the one that you're doing matters because patients cannot be expected to verify everything themselves. They cannot build the skill to be able easily to see the truth between the lies. Third-party platforms like the one that you have created balance marketing and accountability, which is really important. Patients who are interested in having hair restoration surgery really need to understand that it is a lifelong decision and it should not be taken lightly. And I'm pretty sure that almost everybody is putting a lot more research on which phone to buy, whose next phone to buy between several brands.
I agree.
Yeah, and then he or she puts on doing a surgery that will be on his, most patients are male, on his head for the rest of their lives. It is really important so even if it takes like a week or two to build the skill on seeing between the marketing tricks and the promises and the fake promises and the truth, it is really, really going to pay back like anything else. Actually, and honestly, and I want your take on this. I don't think a man can spend money on anything else, that amount of money, that will bring back more return on investment in terms of satisfaction. So, in my opinion, a successful hair restoration that takes someone from a complete bald head sometimes, or a balding, or a severe bald head, to a head full of hair with just money is something that will pay back every single day and every single time you look yourself in the mirror and you do this. By the way, all this, look at this, all this hair of mine, all these are transplants. I had 3 transplants, altogether 9,500 grafts. I would be a stage 6.
Wow.
And all these are transplants. My baldness would be down to here. Okay.
Wow.
So imagine speaking to me and I would be completely bald. And now after 3 successful hair transplants, I have a full head of hair,
Mhm.
right? Of course, I'm blessed with a thick hair and, an excellent donor area that can give a lot of grafts. But this doesn't mean that only people with my characteristics can have a result like this. But honestly, if there is one thing that someone should not be cheap with, this is something that you have on your face and on your head. I trust me, no matter how much you pay, if it is an excellent transplant like the one that I can provide or like the ones that the surgeons that you advocate can provide with evidence, you will never ever regret this investment. But what you will regret, what somebody definitely regrets, is if he makes a cheap decision, he will regret it every time that he could have looked in the mirror and be proud of his decision. Every time he will look in the mirror with a cheap decision, will be ashamed of his decision. And it really doesn't work. It really doesn't work.
No, it doesn't. And, when people do cut corners with hair restoration surgery, whether it be with the research element or the cost element, they end up sadly paying for it in the long run. And, one thing we touched on there, you see a high number of repair patients who then, when they do come to you, you are presented with limitations as to what you can then do for them. So, in
It's
line
true.
with that, and a key topic that is, highly discussed of late is donor management, the
Hmm.
area of hair that we can kind of transplant from, and the long-term ethics surrounding that. Most bad hair transplants, for the most part, by today's standards, aren't necessarily unnatural looking. It's a case of the long-term planning aspects and the donor region hasn't been used as efficiently as and effectively as it can. Now, there are many cases where patients don't look natural either, but what we're seeing now, because of this competition out there to perform larger and larger sessions, what is happening as a consequence of that? The patient's precious donor supply is being jeopardized. And what is your take on this? And what thing do you have in place or philosophies around donor management and managing that so that patients have options short, mid, and long term? Because nobody just gets one hair transplant.
No, it's really rare. So I'll tell you. So I started like 20 years ago. I started with strip surgery. Strip surgery, to be honest, is my favorite. And at that time, like 20 years ago, back in 2004 or five, he was just starting. Strip surgery, if it's done correctly, it's excellent. It has specific indications, very few at the moment, so I rarely do it anymore. But strip surgery was actually had a very high barrier of entry. In order for someone to do strip surgery, he had to be a surgeon. He had to know, he had to have some experience. And so maybe 100 doctors would be interested in hair restoration, the moment they would see the strip surgery, they would say, whoa, 95 of them would stay out. And only the 5. And out of these 5, 3 or 4 were really good. With FUE, the barrier of entry has lowered so much that anybody feels confident to try. And now you have all these 100 doctors who are interested to say, yeah, I can do that. Of course, they cannot do that, but it seems much easier than strip surgery. And the problem is that now that you end up with 100 doctors, out of which 5 are actually dedicated and willing to go all the way to excel, and out of these 5, 3 will make it to the top. Now you have 100 working on it. This is a problem with this is one problem with the lower barrier of entry of FUE, and this has created a lot of issues all these years because back with strip surgery, the surgeon would first become a surgeon, which comes with some kind of skill and maturity and thoughtfulness. And then he would go to hair restoration. While now, doctors, very young doctors, just out of medical school, will first start doing FUE excision on poor patients' donor area And then they will start building some maturity and thoughtfulness after causing complications. This is why we see so many destroyed, decimated donor areas and terrible results in the recipient area, because this go hand in hand. You cannot have a bad donor area with a good recipient area. It's impossible.
Mm.
So these are people who have not understood the not even the fundamentals, exactly because the barrier of entry of doing FU excision and planting grafts is very low. It's generally a safe surgery. It's nothing like strip surgery. Strip surgery, it's really hard in order to harvest and suture it and not having complications and a lot of issues. Managing the donor area and how to implant the grafts has some fundamentals, and there is an art in it, an art aspect of it. However, in contrast to what is advertised to laymen, which is more is better, actually the exact opposite is true. In hair restoration, less is better. If you can, what you're going for in hair restoration surgery, you're going for two things. One is natural result and coverage. If you can give coverage with less graft because the hair is wavy, like my hair, or there is a low contrast, somebody's blonde with white skin, it's the ethical and honest and skillful way to do it is to implant less graft, not more. However, people will respond more to more grafts. It's like they see the scorecard of a basketball match. 140, 60. Wow, they destroyed them. That's not the point. The point is to get the result with with the least number of grafts, because
Mm.
you don't know what the future brings. And the
Yeah.
future might bring very negative surprises. A lot of people might end up with, not a lot, but some people might end up in chemo sometime in the future. A lot of people might end up with some kind of scarring alopecia. And even if you do a great surgery, but that you harvest all of the grafts from a donor area, not over harvest, even if you take out all. There are a couple of surgeons, or 3 or 4 surgeons in the world who are not bad surgeons. They have good results, but they advertise 9,000, 10,000, 12,000 grafts. This is totally wrong, because you don't know what happens in the future. You always need reserves. I don't mean that, leave a patient half bald or thin to have results, but you
Mm.
can get the same result with 6,000 grafts. I have so many examples with 6 or 7,000 grafts that other surgeons, which I respect, would have spent double to have the same result. So
So what's your opinion on that then, Doc? That these doctors are using significantly more grafts than they need to, but also
it's
in line
wrong.
with the fact that, well, what is your opinion on the way that these surgeries are then? Because my issue lies with how these surgeons market these high numbers as the norm, when in actual fact, it's it's the minority of patients that might even be eligible candidates for very large sessions. But the average person feels that then they have an advantage by going to this surgeon because they can somehow get way more grafts out of their donor supply than any other surgeon. So what is your particular take on that? And what do you think the industry should do about this? Because in turn, patients are going to end up, a high number of them, in my opinion, left out to dry because they will not have the donor supply available to them. One, that they've had those very, very, very large sessions performed on them if they need further work, but also a number of patients are going over to these surgeons and then they're possibly, I would have hoped, finding out that they haven't got that donor supply to work with because the average head. What is your opinion on that?
The average has there is no actual average, but I will tell you what is the
You understand the point I'm trying to
yeah,
make here.
absolutely, absolutely. I'm just yeah, yeah, yeah. The most frequent measurement that I have on the donor capacity of between the age of 30 and 50 is approximately 6 to 7,000. So this is the most frequent number that I see, if you want to call this average, which is not wrong, but just that making sure. So probably this is called, it's the, probably is the medium. It's called the medium. So what these doctors are doing, so there are two types of clinics who advertise this. Clinics, low-cost clinics that try to lure patients
Yeah.
by a fixed cost with unlimited grafts, okay? And there are super premium in terms of fee surgeons who attract patients by a record number of grafts. There's nothing in between. Everybody else in between, like myself, is like, I will examine you and I will tell you how many grafts you need and how many grafts we can transplant per session safely. Safely, what does it mean? That your donor area looks like virgin, especially after one surgery, and that we have approximately 100% of growth. Okay, this is
Hmm.
what I mean safely. Safely doesn't mean that you don't die in surgery. It happens even once a year, even in Turkey, that they operate by the thousands. So safely means donor area looks perfect and you have approximately 100% growth. Now, this cannot be done with large number of grafts. From my experience and from the experience of excellent surgeons that I have worked with, on a virgin donor area, anything above 33,500 to an extreme donor area, 4,000 grafts in 2 days with FUE, anything above that is not safe for the donor area. Or how do you know? Well, I don't know, but I don't want to test it.
Hmm.
I know that with 3,500 grafts, I never had a problem. So why push it more?
Mm.
Why push it more? I'm not going for a world record. My goal and everybody's goal as a surgeon is to give a safe result to the patient. You don't need to give a record-breaking result. Only it's whenever you see something like this in science, it's this surgeon is not making records on his own head. He's making the records on someone else's head, and this is unethical.
Mm.
So you can keep this number. So maximum, if you want it, so the 4,000 grafts in 2 days is an extreme. I've done like once a year. About anything above 3,500 is risky for the donor area. Sometimes the donor area, I have a case like this today. Sometimes the donor area can give easily 3,500, but the recipient area has been bald for so many years that I do not trust to make so many incisions on that area. And
Mm.
even though so every case is unique. In which way? In a way that every chess game is unique. You have the same board, you have the same pieces, and there are rules, but every game is unique in chess. The same is with hair restoration surgery. There are rules. Sometimes you might, if you're a real expert, master, if you're a master in chess, grandmaster, you can not exactly bend rules, but you can do some magic, but there are rules. But every chess game is different. And people who come and say that I am doing something that nobody else is doing is like telling you that on their board, the king can move like a queen. No, it's a lie. End of story.
Good analogy, Doc. You're coming out with some really good analogies here. I like them.
Yeah, I'm good in that.
Yeah, no doubt. So look,
So
look.
people should be people when they people we all like, especially as males, we like to see records, we like to see fighters, we like to see extreme performances. This is why Red Bull is so popular with all these things that they're doing. This is why UFC, this is why soccer is so, because we always want to see who is the best and who scored the more goals and everything. This is in sports. When it comes to science, what you should be looking for is thoughtfulness, not extreme behavior. This is not sports. So everybody should do this. Click the switch to different criteria when you are judging a scientist. You have to click and say, I'm testing for thoughtfulness and for long-term results and for the long game. All these people in either these two extremes, the very cheap clinics in low-cost destinations and the very high fee operators who offer extreme number of grafts are actually pressing the button of that every male has on his head. Wow, I want to see a high score. Don't do that. Flip your switch and go for long-term result and for thoughtfulness. And you will never, ever be betrayed by this.
That's a good point, Doc. Well, look, we've been dissecting this space for a good 45 minutes here. I'm mindful of time, but what I want to do is just kind of get your take as well on preventative treatments and what your thoughts are on oral minoxidil. Is it something that you advocate in order to create a stable environment for patients?
Absolutely. So, as I told you before, I can give you examples, but generally, so every case again is unique. So, let's say that, for example, I have someone your age, 50 years old, with the frontal area completely bald, but a very thick mid scalp and crown. It happens a lot. I will only suggest to this patient to start minoxidil after surgery to help me with the grafts, and I will not put him into finasteride unless I see a lot of miniaturization in the donor area, which is quite rare. So in general, in my clinic, the only things that I'm using is minoxidil, finasteride, and in some very selected cases, low-level laser therapy. I don't do any PRP. I don't do any exosomes. All these things might have some shady literature data supporting it and have a lot of hype on the internet, but none of this has ever even approached even the most expensive PRP, the most expensive stem cell therapy has not even close to 2% minoxidil. Okay. So it's really funny that people are so eager to jump to the next miracle treatment when you have things that work. So the things that work are minoxidil, finasteride, and in very selected cases, low-level laser therapy. The protocol that I'm using is before surgery is changes according to the patient, according to his needs, according to his age. Before I start finasteride, and I believe this is important, I have been advocating this to the ISHRS meetings for more than a decade now, and I'm still getting some backlash back, but no, but it doesn't make sense. Before starting finasteride, I always ask for a PSA measurement and for a sperm count. Why? Because I don't really believe that finasteride can damage anybody's sperm, especially if they're young. But if somebody is infertile at 25 already, I start him on finasteride, he goes well, and at 35 gets married and wants to have a child, and then he realizes that he's infertile. What do you think his doctor will tell him? That finasteride destroyed his life, while he already had a problem. So every year I'm giving hundreds and hundreds of sperm counts. Unfortunately, the last 6 or 7 years, the percentage of seriously infertile young males has increased a lot. So I only talk with her urologist whether he agrees with finasteride or not. And if he doesn't agree, Spencer, I will not give it. Is he right? I'm definitely not sure, but I don't want to risk it. Would you? It is just hair, man. It is just hair. If somebody is on the borderline of being fertile or not, and with finasteride, it might go just below the line, it doesn't worth it. So every case is unique. So, but before I give finasteride, I always ask for a baseline PSA and a sperm count, and then we start finasteride. And seriously, more than 90% of cases will have amazing results. Not on the frontal area, because the frontal area, in order to have a frontal area like mine or like yours, only hair restoration, successful, natural hair restoration, it gives you a hairline, thick and natural hairline. Prevention therapy, medical therapy can really support the whole thing, the whole head in a magnificent way, as long as someone is a good responder. Finasteride has a high percentage of response, really 80, more than 80% of patients will respond positively, some of them impressively positive, which I don't even believe it, how amazing the result is with just like a year of finasteride, and another 50 to 60% with minoxidil.
Well, it's always good to get a different surgeons' opinions on how to best approach progressive hair loss. Obviously, we deal in an industry whereby, hair loss is progressive. So we need to do all we can to help provide a safer environment, especially if you want to build on that. So there's, like you said before, there's so many different kind of aspects. Every patient is so different that each patient has to be taken on their own merit, and the best course of action for them needs to be put in place. So listen, Dr. K, fantastic to have you on board today to interview you, to allow patients to get to know you a little bit better. And I look forward to interviewing you again soon. And thank you for everything that you do in terms of guiding patients accurately and ethically and enabling them to, if nothing else, establish what their requirements are and
and
pointing them in the
offering
direction.
and offering them the result that honestly, I have very few patients who come to me, and I always ask them when I give them a testimonial because I'm making hundreds and hundreds of videos. Is it what you imagine? 95% says no, it's much better, man. I never believed that it would be this good. And this is because so many people see results of hair restoration that are not natural, not fit, some hair growing here and there, and they're not satisfied. And it's really so heartwarming. I had a patient, actually two patients yesterday who came back for the 12-month reevaluation, and they were so happy. One of them gave me a testimonial of 6 minutes. He wouldn't stop. I have to make like 6 videos on Instagram to upload them. I don't know who's going to see a testimonial of 6 minutes, but he was so animated and he was an older gentleman with gray hair, and he was so happy. Says, changed my life. So
Fantastic.
really, if you ask me, and I still haven't found anybody to say I'm wrong, successful hair restoration is the most impressive aesthetic surgery that anybody can have. There is nothing that you can change on a healthy body, okay, that will make such a great difference on the appearance than a successful thick hair restoration. And this is what people should look for. Don't not cutting corners, making their due diligence, the good research. It's not hard. Be a doctor, see some Google reviews with pictures, and ask to see videos of cases like yourself. You immediately you are left with less than 1% of the of of uh, clinics or operators who are advertising for hair restoration. You are left with less than 1%, and then you can just pick from those 5 people who have reached this very simple criteria.
It's great you're so passionate, Doc, and that's why it's fantastic to be able to put people and patients, prospective patients, in touch with you to get
Thank you.
educated. So listen, Doc, thanks so much, and we will speak again soon.